When the pain of an arthritic joint is not being helped by conservative care, a joint replacement might be the best option. We spoke with registered nurse Vickie Miersma of Pomona Valley Hospital to learn about the total joint replacement.
A total joint replacement consists of the surgeon going in and resurfacing the joint of either the hip or the knee of a patient. As a clinical coordinator for our program, I contact the patient before surgery. We try to coordinate care. We want to make sure the patient is ready for surgery. We give them education. We try to engage them in self-care so that they will take responsibility and they will care for themselves once they are finished with surgery. They'll do the exercises and they will continue with what the program recommends after surgery and once they're at home. I actually teach a class. It's called our Total Joint Preparation class once a week. And in that class, we go over what to expect while you're in the hospital. So we go over pain management, physical therapy expectations, the information that we teach for patients when they go home is called the basics after joint replacement. And it goes over like blood clot prevention. It goes over their medications to take at home as far as home medications, as far as pain medications goes. It goes over incision care, signs and symptoms to report. It goes over precautions and safety when you're at home, because a big part of joint replacement is making sure that you're safe. Once the patient is scheduled for surgery with our scheduling department, I have their information. I give them a call about a month before surgery, and we have them come to class. And in that class, we answer any questions. We go over preparing for surgery, what happens while you're in the hospital, what to expect when you go home. And also, they have the information of how to contact me if there's any problems in coordinating their care and getting any of their consults done, where they need clearance from a medical doctor or from a specialty doctor. Our program has a nurse practitioner who sees the patients when they're in the hospital after surgery, and she has our specific one has pain management certification, so she helps manage pain while the patient's in the hospital, as well as she helps with the transition of getting them either to home or to rehab after surgery by working closely with the doctors, the surgeons, nursing care, nursing staff, physical therapy, and our case management department. It is very rewarding, my position as a coordinator. I do get to also call the patients after they're discharged from the hospital, and I get to ask them, all sorts of questions. And in asking all those discharge questions, we find ways that we can help educate the patient and help resolve any issues that might have come up as well during their discharge from the hospital. And in all of that, we are able to take that information and make our program better. We actually had a patient come and show us the results of the surgery and come in and show us that he was walking without a walker and how well he was doing after surgery. It was really very rewarding, very rewarding.